Welcome, everyone, to another edition of SCRC's Let's Talk Caregiving. I'm your host, Roberto Velasquez, President and CEO of SCRC, and I'm here as always with my co-host, Marta Rañón, our Executive Vice President.
Hey, Roberto.
Hey, Marta. Today's special guests are Alina Shah, Director of the COVID-19 Response Team with Project Concern International, now known as Global Communities, and Victor Ruiz, Program Coordinator and Outreach Specialist for the COVID-19 Response Program. Welcome, both of you.
Great. Thanks so much, Roberto. Really excited to be here today.
Yeah, absolutely. We're very pleased that you're here. I know Martha's told me a lot about your company at Global Communities, and you partnered with the County of San Diego Health and Human Services Agency to conduct contact tracing and vaccine education and outreach related to COVID-19. And I'm really happy that you're both here. I wanted to ask you to tell us more about what you do and why it's so important to our communities and to our audiences.
Sure. Yeah. So our team has been working on COVID-19 in collaboration with the county for over the past year. And as you mentioned, we started out contact tracing with the EPI department. And that really gave us a good foundation of understanding what are the challenges that people are facing with COVID-19 in their day-to-day lives, whether it's, having issues isolating or quarantining at home. Everyone's situations have been so different, being able to do that safely, and also be able to take into consideration all of the other factors of life that are impacted, whether it's work and your income, being able to find childcare, working with families to kind of share that burden, getting food, all of those issues. And so we stopped contact tracing in May and the start of June. And our whole team has transitioned over to doing education and outreach for the COVID-19 vaccine. And we've really been focusing in North Central and Central San Diego, but we can reach people across the county. And with that, we are able to do a lot of in-person outreach. And also we have an Instagram account.
I'm so glad, Alina, that you and Victor are here to tell us a little bit more about your efforts and what you're planning to do in the community. And, when Roberto and I were talking about having you on, we were really excited because we obviously our focus is the family caregiver. And we understand that a lot of family caregivers are caring for those who are vulnerable, who have some sort of chronic health condition, and also those who have smaller children who might not be vaccinated because there isn't a vaccine available at this time. So all of those factors coming into play for a caregiver is a lot to consider. And we're hoping that today you can kind of help us, guide us as our listeners are here with us today to see how they can better prepare themselves as they go, through their daily lives here in the community.
Yes, absolutely. And thank you again. Thank you for having us. And yes, I think that when it comes down to consider what are those things that are important for me as a caregiver, how can I best protect myself and others? I think that right now the main topic is, being vaccinated, right? Because being vaccinated right now is the best way to protect yourself and the person or people that you're caring for. And it's also as important that the other person that you're taking care of is vaccinated as well. In this case, part of the guidance, as we've seen throughout these months, there are multiple guidelines out there. However, we always come down to the basics, the importance of using or wearing a mask, and also being vaccinated. And as well, if you're out, something that we mentioned out in the community as well, and in this case to our caregivers, is if you're vaccinated, the mask use is recommended. And if you're not vaccinated, then the mask is required. However, we're trying to encourage our family and friends to be vaccinated and pretty much ensure that our whole network is safe.
So I'm glad you say that because, and what Martha said earlier about our clientele, our clients are the family caregivers, and many of them, close to 50%, are are kind of Gen Xers, a little bit younger, 45 to 55-ish, around that era. But they're caring for very vulnerable people. And one of the statistics that I thought was important that I saw from the CDC was that older adults, 65 and older, are at 94% of a reduced risk of hospitalization or serious illness from COVID-19. So making sure that our families get vaccinated is incredibly important. So I really applaud the work that you are all doing out there, especially with the education piece.
Yeah, Roberto, I think that's really important. And one other thing is that oftentimes people who are taking care of a family member who's more vulnerable or at risk is also really kind of a nucleus for other members of the family as well. And as Victor was saying, we really like to think of everybody's connected here. That's one thing that we've learned a lot over the past year, and that's including in our health. So as a caretaker, a caregiver, you can also think about your role in also promoting the health of others in your family, talking to family members about the importance of getting vaccinated, whether it's children or nieces, nephews, cousins, and other people that might be coming into contact with that person who you're caring for as well. It's a whole family system, and everyone getting vaccinated, everyone taking care of themselves also helps us take care of each other.
I'm so glad you mentioned that, Alina. And I wanted to ask both of you, because I know there's a lot out there. A lot of things are changing, right? Things are coming up every day that are having to be adjusted, right? From recommendations, to requirements, to suggestions, to optional. And so there is a lot of information that can get very overwhelming to anyone who's trying to follow this. We've never been in this situation, so obviously we're trying to stick to factual information and learn as much as we can from these entities that are giving us this information. But I wanted to see if maybe you too can help us sift through some of those myths, some of those rumors that exist that are really causing harm to those who are not sure what to believe. And so I was hoping that maybe you can share some of these today.
Sure. Maybe a good one to start with is that the vaccines aren't safe. And I think that one is something that we hear a lot in the community, that they're new on the market, that we don't really understand what's gone into them. And while we understand that because it's a new concept for a lot of people, it's important to keep in mind that there's been years of development, especially for these mRNA vaccines, which is what the Pfizer and Moderna are, that have gone into developing them. So we have lots of data, lots of different people who've been part of trials before it even was applied to COVID. And with that too, something that's super exciting is that this week on the 23rd, FDA approved the Pfizer vaccine for everyone 16 and older. So with that, it means that we have that much more information, that many more people who have been traced very carefully through this process to show that it's safe. And actually, Victor has a really exciting story about this that just happened this week.
Yeah, so I have a family member. He is in his early 30s, and until a few days ago, he had not received his COVID-19 vaccine. And the thing is that at family gatherings, whenever this topic was brought up, he would mention these common arguments and slash myths that we're listening out there in the community, such as, I want to wait more to see what happens to the people who receive the vaccine. Also, this whole deal of the pandemic and the vaccine looks pretty sketchy. And also, we don't know what exactly what's inside the vaccine. And finally, that argument, right, that these vaccines are not approved yet. And again, this is happening within the family setting. And after multiple conversations with him, and it's very important for me because it's not only about our family, and it's also the work that we're doing out in the community. So it has more weight to what I'm doing. And I was seeing that there was no success, right? And finally, after several conversations this weekend, he approached me and he said, hey, I want to take the vaccine, and after talking more about the subject, the reason why he decided to move forward with it is because he said, well, I think it's also important to take into consideration the rest of the family and my friends. Not only this is about myself, it's about others. And that's how we just went ahead and decided to schedule the appointment. And now he received it on this Monday.
What a great
That is
story.
great.
We often hear the horror stories. We hear the stories in the news of all the deaths. We know our own friends and families or neighbors who have become incredibly ill because of the COVID-19 virus, and have many of whom who have passed away, who have died because of the complications of this virus. In San Diego County, there's over almost 4,000 deaths so far. In California, about 65 million, over 65 million deaths. In the United States now, over 643,000 deaths. And so those are the stories we're hearing a lot. I mean, I can tell you stories of certain neighbors, in people that we grew up with, who didn't even know that they had underlying conditions, but they did get the virus, and then unfortunately many of them passed away, and they passed away alone because of the virus and how contagious it is, and being by yourself while you're dying. I mean, that's one of the saddest things you can ever hear. So it's really nice to hear a positive story about somebody looking out for not only themselves, but for the people around them.
Yeah, Roberto, I think that, it's tragic that we've had to go through all of that. And, we mourn the loss of so many people and whose deaths could have been prevented. Something else that we're hearing a lot right now as the Delta variant is surging is, why should I get the vaccine if people can still get sick? Especially because we were told initially that the vaccine could prevent transmission from one person to another, which is not what we're seeing. And I think one thing to keep in mind is that this is a constantly evolving situation. The scientists are staying on top of it. And it's good that they're changing their mind. It's good that they're changing the recommendations, because it means that they're following it really closely and trying to come up with the best information to keep us safe. But the other thing to keep in mind is exactly what you're saying, that we can still get sick from the virus even if we're vaccinated, but it's preventing that severe illness and that hospitalization and death of people. And so that's really what the vaccine is doing and what we want to prevent, especially among people who have those underlying conditions, whether they know it or not, because they're at highest risk. And so that taking that step help us, we might get sick with, some bad symptoms, but we're seeing not nearly as many people going to the hospital or dying because of it. And that's really what we want to keep in mind here.
Alina, you're absolutely right. In fact, I was looking at more data. I'm always looking at data. Martha always teases me because I love data. I was looking at more data of the newest cases that are really kind of impacting the hospitals. And the vast majority, about 90+%, are people who are unvaccinated. There are a smaller percentage of people who are vaccinated who are getting hospitalized, but the vast majority of those who are vaccinated are having those milder symptoms. It is incredibly important, especially if you're a caregiver and you're caring for somebody who is elderly or has some chronic condition that is compromising their immunity or their health on a regular basis. So again, incredibly important about the vaccines.
Alina and Victor, I was curious from your perspective, since you're out in the community and you're working with people, especially trying to disseminate some of this information. Let's say some of our listeners are still kind of not sure. I know you talked about your friend Victor, and it took a while for him to come around. What do you tell people who are listening who might say, well, I'm still kind of hearing this, I'm not sure? Where should they go? What should they do so that they can be fully aware and informed? Because there are now a lot of requirements, right? A lot of places of work are requiring that you show proof of vaccination. A lot of kids are going back to school. And so I'm just curious to see, what can we tell our listeners? Where can they go to get more information?
Well, thank you. Two main sources come to mind, and that's where I refer people. Sometimes I'm from the community. One is to reach out to the Center for Disease Control official webpage, and also the World Health Organization. At least for us, when we're out in the community, we also rely in the information that the San Diego County is providing, which is called Be COVID Safe. And at least from what I've seen, I tell people read, because we provide pamphlets and we provide information as well. But I like how the information is presented from the San Diego County, because it's pretty easy to understand. We clarify in those pamphlets and that online information that people can find what's inside each vaccine, what are the myths, what are the facts as well, the process of the development of the vaccine as well. So many of those questions are already in these web pages, but also we encourage them to check in with their doctor if they want to have more information. There are resources like us from global communities where people can reach out to us for more questions about not only the COVID-19 vaccine, but also referrals for testing. There are many areas that we can cover in regards to community doubts, questions, concerns, etc.
Yeah, something else to add here is that a lot of those resources are available in English, in Spanish, Arabic, Tagalog, other languages too. So if you or a family member might not speak English or want content in other languages, it's good to check those out as well to help people understand in the best way for them to learn that information. And along with educating yourself with information that comes from a really strong, reputable source that's based on science and the actual information, I think is also having conversations with people that you trust, who you also know are well informed. So our community health workers, our outreach specialists can be one source of that. And you can follow us on Instagram at covidfree.sd. I know that the Southern Caregivers Resource Center also has information for people. So it's going, to those locations. If you want to talk to someone one-on-one, I think that's a great source. And we're not here to convince people to get it. That's not what our job is. Our job is to provide the information, help you talk through it. And if you do reach the point where you or someone that wants to go get the vaccine, we'll help you navigate that to go to a location that's close to you, that feels safe, and where there are people there that are working in a language that you or your family member might also want to do to make it the most comfortable and safe environment for you.
Thank you for mentioning that, Alina. I really do appreciate it. And actually, if I can plug in our upcoming event that we are partnering with the global communities on, if all of you who are listening are still needing to get a vaccination or know someone who needs either their first and second dose or their second dose, we will be having an event, a vaccination event, a free vaccination event on September 16th. From 9 a.m. to 2 p.m. at our office, Southern Caregiver Research Center, 3675 Ruffin Road. Of course, you could always check out our website to get more information, scrc.care. I'm hoping that people attend.
And I think you bring up a great point with the first and second doses, Martha, too, is that if you've received the first dose, but you haven't received the second dose, you're not fully protected until you receive that second dose and you develop immunity 2 weeks later. But also, if it's been more than 3 weeks or a month since you got that first dose, it's still super safe for you to go get that second dose, and really important that you do get that. So, we tell people, don't be embarrassed or afraid that going and getting that second dose means that it's going to be any less effective. So if you're in that situation or someone who's in that situation, still come out to this event, because we'll be providing both. It's the same dose. We'll have the Moderna and Pfizer, which means that also if you have a kid or of someone who's 12 years or older, they can also get vaccinated on that day as well.
Thank you for saying that, Alina. I appreciate it.
Yes, thank you so much. We've been living with this pandemic now for over a year, and we're so fortunate now to have a vaccine that people can take advantage of and take and help reduce the spread of this terrible virus. So, I encourage everybody to continue to stay informed to educate themselves, to get vaccinated, and to wear masks. Especially if you're a family caregiver, you're protecting not only yourself, but you're protecting the individuals that you care for and love. So please educate and get informed, and we can pull through this, and I appreciate all the information being shared.
Also, talking about caregiving for someone who might be immunocompromised, something else to keep on your radar right now is that CDC approved a third booster shot for those people who are immunocompromised, especially those who are 65 or older. So also take in mind that person that you're caring for, talk with their physician to see if they qualify for that, and get them that third dose. It's important for them. Their immune systems aren't as strong as some of the rest of us, so that third dose really gives them that full coverage. And I know some of us are really excited about seeing if we're going to be eligible for that third dose, if that's coming as a booster. Be patient. There's still a lot of information that the scientists are looking at and taking consideration of. It's important that we wait until that approval does come through to make sure that we can get that booster at a time that's going to protect us the most. But for those folks who are immunocompromised, it's a green light. Go ahead, bring them to our event on the 16th. We'd love to see you there.
Excellent. Well, that's all the time we have left for this edition of Let's Talk Caregiving. To hear more of our podcast, follow us on your favorite podcast platform or visit our website at scrc.care. I want to thank Martha for co-hosting another important discussion, and our guests Alina Shaw and Victor Ruiz of Global Communities. And I want to thank also our audience for tuning in. If you're providing support to a loved one, you don't have to do this alone. Asking for help is not a sign of weakness, it's a sign of strength. To connect to our programs and services, visit our website at scrc.care or call us at 1-800-827-1008. If you're residing outside of San Diego and Imperial counties, visit caregivercalifornia.org and get connected to a caregiver resource center in your area. To support our efforts and make a tax-deductible donation, please go to scrc.care and click on the Donate tab. And remember, SCRC is here for you,
caring for those who care for others.
Thank you.